Okay, beautiful. Good morning once again. Welcome to Kisii Physiotherapy Clinic, and today we are delighted to have one of our guests here. And kindly, sir, briefly tell us more about yourself.
Yes, my name is Solomon Kinara.
Yes,
I'm a consultant physiotherapist,
yes,
long-serving experience.
yes,
I've worked in Voi, Garissa,
yes.
Nyeri, Kenyatta National Hospital.
Mm.
I have over 30 years operational experience in this profession. And I'm actually the director of this clinic business with two other therapists who are assisting me.
Yes. Thank you for that. Thank you for that. I also have something to ask you. Kindly give us the name of the clinic, a brief history of the same,
Yeah.
and maybe the vision and the mission. Of course, you have as other clinics do also have.
Yeah.
Yeah.
The name of the clinic is Kisii Physiotherapy Clinic.
Yes.
Situated in Sansora building along Hospital Road.
Yes.
And it has been operational for over 15 years.
Yes.
And we also have partners we coordinate
Yes.
in referral issues of clients,
Mm-hmm.
like Medford Hospital, Kanyumba Hospital,
Yes.
and almost all consultants,
Yes.
whether orthopedic, clinical, pediatric, geriatric, and so on.
Yes.
Yes.
And as I've said, like any other hospital or any other health facility, of course, you have your vision and mission.
Yeah.
Kindly, maybe you can briefly tell us one or two.
Yeah.
Yes.
Our vision
Yes.
is to improve the degree of service provision in our discipline
Yes.
so that we keep abreast even to the new techniques for handling clients or conditions
Sure.
for the purpose of efficiency and effectiveness.
Yeah. Okay. Again, on a last summary, maybe you can tell us what are the services that you offer in your clinic, the Kisii Physiotherapy Clinic.
Yeah.
Yeah. Sure.
The services we offer
Mm-hmm.
are a variety. One is exercise therapy. The purpose of exercise therapy is to strengthen weak muscles.
Yes.
When a patient lies in bed or is not active,
Yes.
the muscle fibers start dying slowly, gradually, until now they find that balance is a problem, and even dizziness when they stand, and this indirectly affects even the internal organs, like the heart, because when you do exercise, the heart is the one that pumps blood, supplies to all parts of the body for the purpose of nutrition and the energy production and the healing.
Yes.
Yeah.
Okay. That's great. On the same page, maybe may I ask that do you only offer physiotherapy services at your clinic? That is the outpatient services, or you also go for, or maybe you have some other local arrangements there?
I'll answer that, but before I finish, I talked about exercise therapy
Yes.
first. We have also what we call electrotherapy.
Yes.
This includes things like nerve stimulation,
Mm-hmm.
which is touching the paralyzed nerves
Yes.
by virtue of various causes,
Mm-hmm.
like facial palsy. You are seeing a patient with a twisted mouth
Yes.
as an effect of facial nerve compression or other causes,
Yes.
or stroke, which happens in the brain but affects one side of the body and is quite debilitating, Those things need nerve stimulation plus others. We also do rehabilitation therapy in various ways, like cerebral palsy patients, those kids who are born with delayed milestones and have weak limbs. So we tend to strengthen their nerves and muscles and generally improve sitting or trying to walk. Yeah, those are some of them. And of course, we also do some counseling of clients whereby they need to be made aware after being sent by the physician or the surgeon. We now counsel them as to what they could have done to preempt this condition that came about if they could have been active and strong and mentally, tuned. Provide home visits.
Yes.
These are for the patients, like some stroke patients may not come if they need 15 or 20 sessions of treatment.
Yeah.
May not be able to come to the clinic on a daily basis. So we extend our services to their homes
Yes.
under mutual understanding.
Yes.
And then the patient finds that they also get the benefit of familiar environment,
Yeah.
and that boosts the healing factor.
Yes.
We also give educational lessons generally in our website. There are some sections we talk about. We can talk about stroke, about paralysis in general, about sarcopenia, which is loss of muscle power as somebody ages above 60 years.
Yes.
There is a natural decline in muscle power, which eventually affects the brain indirectly, and then somebody finds that he can lose balance easily and fall down.
Yeah.
But such a patient, if he was advised on or in time, they could prevent that by getting a special professional home program of exercises, which they will do. We will train them to do so that they preempt the muscles from dying off. It's a natural death. When the age comes, you will find that a muscle which was taut and firm starts becoming flappy. And then that means there is no enough circulation and nutritional supply because of lack of exercise, which should have sent nutrition to those muscles.
Yes.
And once your general body, outside body, gets weak, even the heart starts becoming weak, the lungs, the kidneys, the prostate, the liver, all those, because they are not getting nutrition because of lack of activity or strength. When somebody is weak because of lack of activity, nerve activity, I mean, the expected activity, not necessarily being a sports person, but enough for your health, the brain starts deteriorating. Mental alertness goes down. Loss of memory comes in. there is a danger of even being hit by an obstacle on the way or a car when they are crossing a road because of loss of men.
Okay,
So,
thank you for that. Yes. I've heard that physiotherapy usually handles some maybe a lot of conditions, but specifically I've not been able to know more about it. Maybe you can brief me on some of the most common conditions that you usually handle as physiotherapy.
yeah, we handle a variety of conditions.
Yes.
Physiotherapy. The most common, for example, is backache,
Yes, back pain.
specifically low back pain.
Yes.
Although we also have neck pain by virtue of several factors. That pain can come because of disc prolapse, which is a protrusion of the cartilage between the intervertebral bones, which compresses the nerves that supply the legs and the pelvic organs. And if it is the compression on the neck, then it affects the arms and the organs within the chest indirectly. So we also have spondylosis, which is hardening of the and erosion of the vertebral bones by virtue of lack of enough flexibility movements in all directions. We have a natural body posture expectation. So when there is a distortion either to the side or to the back or to the front that is magnified, it compresses nerves. And the nerves control all muscles and organs. So indirectly, you start developing other complications. So we also do handle stroke conditions. We handle geriatric conditions. These are conditions for the aged who have become weak. So we try to tune them back to increase the strength and carry out their day-to-day life necessities efficiently and effectively.
Thank you for that. As part of your rehabilitation and therapy session, you have mentioned that you do exercise therapy and equipment therapy. Can you briefly give us some of the example of the machines or the equipment that you use for the services that you have mentioned that you offer?
Yeah, we have a variety.
Yes.
One of them is nerve stimulators, which work on paralyzed and weak nerves. So that indirectly after they are stimulating, they now stimulate the muscles. Nerves are the ones that make muscles work. They are thin filaments, but they make the back muscles to function. That is so nerve stimulators. We have therapeutic ultrasound. These are used for areas like fibrotic conditions, where you find things like nodules within the muscles, some arthritic conditions within joints, and they also assist in breaking down various hardening tissues in various parts of the body. Now, the third one is traction. We have traction for the neck for various conditions like cervical spondylosis. We have traction for the low back, for disc prolapse, for nerve compression, for hyperlordosis or too much front protrusion, and so on and so forth.
Thank you.
We also have body mass index machine, which is this one. It is used to assess the body weight in relation to the height and also the fat content of a person. When the fat content passes a certain level, it's dangerous for the system. And it should not also come below a certain given level. Bodies, similarly, the weight of the body, depending on your height, there is an expected range within which it should fall. If it's either below that or above that, it brings medical complications. So far, so good. We also have things like vibromasters. These are special vibrators for certain conditions, especially in the bulky muscles of the body, to increase the physiology of the muscle within. Physiology means the function. Once you do it properly, there is exchange of the various fluids between the lower, middle, and upper layers of the tissues, so that now, if they had started to stagnate, they start circulating, and it removes the cause of certain sluggish function of the system, plus many others.
Yes, thank you for that. Another thing that I may have to inquire about is that maybe in your clinic you have some of the insurance that cover for your plan. And if yes, which one do you have?
Yeah.
And who are the beneficiaries of this?
Currently, we have CIC insurance, corporate insurance. Is the one that we are using mainly.
Yes.
Plus cash.
Yes.
But we have applied for more insurance companies like Britain, like KBL, and others.
Yes.
So, as time goes on, they will increase, and a variety of people can be able to use their cards conveniently.
Thank you for that. Last but not least, maybe you have to tell us maybe when someone wants to reach you or find you, do you have any social media platforms?
Yeah.
Yes.
We have Facebook.
Yes.
We have Instagram.
Yes.
We have WhatsApp.
Yes.
We have Twitter.
Yes.
And the TikTok.
Yes.
So we are reachable
Yes.
through those medias.
Yes.
And we also have over online consultation services.
Yes.
Somebody may feel that he wants to know about a certain discomfort within his body that is either sudden or disturbing,
Yes.
lingering, that is. So if they are not ready to come to the clinic, they can contact us online,
Yes.
pay some fee, and then we give the advice online.
Yeah.
Conveniently. Yeah.
So thank you for your time, and maybe before we close our time, I've been having my grandmother complaining of her lower joints, that is the knee joints.
Yeah.
I've heard of her talking about arthritis, but I don't know what it is.
Yeah.
Maybe for the benefit of the whole population, today I'm privileged, maybe you can just briefly tell us what arthritis is. Yes, and who are the most people who are affected?
Yeah, arthritis simply means wear and tear.
Yes.
This is osteoarthritis of joint cartilages.
Yes.
Cartilages are soft tissue that act like shock absorbers.
Yes.
Between the lower and the upper bones.
Yes.
In between there we have synovial fluid,
Yes.
which acts as a lubricant to avoid the gliding, the wear, the erosion of the cartilage. Now This erosion or wear and tear comes, one, either through an injury, which makes a piece of bone to pierce the cartilage. And then when it is bending, flexing, then it corrodes, it wears off the cartilage. Eventually, if it is not handled early enough, the upper and lower bones start meeting, causes great pain, and eventually the joint is now, if it is operated, it is fixed.
Yes.
And that causes a lot of convenience.
Okay.
You can't bend your knee or elbow or whatever.
Yes.
Two, natural lack of full range of motion movement
Yes.
brings about drying up of the synovial membrane because there is no stimulant. The synovial fluid is secreted from the synovial membrane.
Membrane.
So if that fluid continues drying up and the cartilage gets its nutrition from the synovial fluid. So if it is not getting fluid, it starts drying up and there is more wear and tear.
Yeah.
So it's important, regardless of your age, to do full range of motion.
Yes.
If it's the knee, you bend it, you stretch it fully, and then flex it fully. All joints like that.
Yes.
That one maintains natural gliding and secretion of the lubricant.
Yes. Sorry to interrupt this. Maybe on the same note, I've always heard the saying goes that prevention is always better than cure.
Yes.
Are there some maybe preservative measures that you can say we can do to prevent further worsening of the same condition? What are some of the things that maybe that you usually advise your clients to adhere to so that it prevents the worsening of the condition?
There are a number of issues.
Yes.
We advise them.
Yes.
One, by virtue of a physiotherapist having his capacity, his knowledge, the anatomy, the physiology, the pathology, the kinesiology of the body, and how they work. If somebody doesn't have to start having pain in order to see a physiotherapist, they can come for advice on their body weight, on their posture, because when the posture is defective, it gives rise to several complications, which gradually become serious problems. So once they come, somebody may come and say, okay, I'm starting to have a small backache. We examine the patient physiotherapeutically, see whether the posture is okay, whether the muscle strength is okay, whether the range of motion is okay. And then you may find that the gluteal muscles, which are the muscles of the buttocks, all the hamstring, behind the knees, front of the legs, behind the lower legs, zimeanza kuisha polepole. So we can advise, we can check the strength of those muscles. Muscle strength is graded to know whether it is power 2, power 3, power 4, power 5. And then we advise and give special exercises to strengthen those muscles before those sagging muscles give rise to neurological problem and several other issues.
Thank you.
What I would also say that if you may be staying somewhere far, but you have a relative in Kisii who might be needing services, you are welcome. We'll courteously welcome you, and you can be our client, whether you are in Mombasa or wherever, or abroad, and you have a relative who needs our services. Please welcome. We are ready to provide services and keep in touch, give you a feedback regularly as necessary.
Yes.
Yeah.
Thank you.